Hi, I'm Lindsay Cox, Senior Manager for Advocacy and Outreach at HFA. This month's Dear Addy question comes from Copay Confused. It reads, Dear Addy, I've been hearing a lot about Copay Accumulator Adjuster Programs, or CAAPs, lately. What are CAAPs? How do I know if my insurance plan has one? And what can I do about them? Signed, Copay Confused. Well, Copay Confused, those are great questions. Copay Accumulator Adjuster Programs, or CAAPs, are becoming increasingly common in the bleeding disorder community. And they are complicated. What are Copay Accumulator Adjuster Programs? Copay Accumulator Adjuster Programs, or CAAPs, are a cost containment tactic where insurers limit the extent to which patients can benefit from manufacturer copay assistance programs. The insurer accepts manufacturer assistance, but does not credit any assistance towards the patient's deductible or out-of-pocket limit, which draws down the full value of the assistance. Once that assistance is depleted, the patient is presented with a bill for the copay or coinsurance associated with the next prescription fill. Patients end up on the hook for out-of-pocket costs up to the full amount of their out-of-pocket maximum. You can read more about CAAPs in our Policy Priorities CAAP one-pager and in the Dear Addy post from February 2019 and June 2018, which includes an infographic. Who is at risk of encountering a CAAP? The use of CAAPs is spreading widely across the U.S. insurance landscape. More than 80% of private plan consumers are getting hit with CAAPs. Every state has at least one marketplace plan applying CAAPs. In 14 states, all marketplace plans apply CAAPs. CAAP language is hard to find, even for experts, and it's frequently buried in plan documents that are hundreds of pages long. CAAPs are often disguised with confusing and misleading names like out-of-pocket protection programs or specialty copay solutions. Plan documents sometimes say CAAPs may be applied. In some cases, the accumulator language has been present for years without being enforced, then sprung on consumers with little notice. If you have a personal experience with CAAPs, HFA wants to hear from you. Please share your story with Project Calls. Collecting data about the hardships caused by CAAPs is the only way to fight their implementation. Why we need protection against CAAPs. Copay assistance is a lifeline for those with bleeding disorders who cannot otherwise access the treatments they rely on to prevent permanent injury or death. CAAPs are counterproductive because they shift costs to patients, discouraging adherence to treatment. Disruptions to treatment worse health and higher health spending all around. Insurers are double dipping when they keep cost sharing assistance from the third party while also collecting the full cost sharing obligation from consumers. Help Insure Lower Patient Copays Act, or the Help Copays Act, HR 5801. HR 5801 is a bill protecting patients from copay accumulators, was recently introduced on the federal level in the House of Representatives. The Help Insure Lower Patient Copays Act, Help Copays Act, HR 5801. HR 5801, a bill protecting patients from copay accumulator adjusters, was recently introduced on the federal level in the House of Representatives. HR 5801, the Help Copays Act, is a two-part solution that 1. Clarifies the ACA definition of cost sharing to ensure that payments made by or on behalf of patients count towards their deductibles and/or out-of-pocket maximums. And 2. Closes the EHB loophole to ensure that any item or service covered by a health plan is considered part of the plan's EHB package, and thus cost sharing for these items and services must be counted towards patients' annual cost sharing limits. Join HFA in asking your legislators to support HR 5801 to protect patients from these harmful insurer practices and ensure that all copays count. Send an email to your officials and make a difference with just one click. Head to the link below to connect with your lawmakers today. For questions or comments, please contact the Policy and Advocacy team at advocacy at hemophiliafed.org. Thank you. As always, we enjoy getting questions from the community, so please keep them coming. Submit your questions at dearaddy@hemophiliafed.org. Thank you.